Hi everyone, Dr. Timothy Gallagher here again at Maragal Medical. This week we're going to be talking to you about treatment strategies for repetitive injuries. Now when I say repetitive injuries, most of you may think such things as carpal tunnel syndrome from extensive typing on the computer or faulty mechanics at work. But repetitive injuries can have a lot of different causes depending upon the activity that you're involved in. And this week, our medical director, Dr. Michael Marciello, is going to be talking to you about why our clinic has a unique approach when it comes to repetitive injuries. Take it away, Dr. Marciello.
Repetitive strain injuries. We've all kind of heard the words, but maybe we all don't really know what it means. It often is referred to as repetitive motion injuries, and we may all have been identified as probable cause of an injury or probable cause of some inflammation or pain, but it's very confusing and it's a very vague term that we may also hear from other doctors or from other people. So what is a repetitive strain injury? Well, we think of it as most commonly our upper extremities. Commonly people think about carpal tunnel syndrome. If you're on the computer typing away on a regular basis, you may develop carpal tunnel, and carpal tunnel can fit under a category of a repetitive strain. But it's much more broad when we think about repetitive strain injuries. We think about repetitive movement, repetitive activities that surpass the ability of the body to succumb that strain, such as we call repetitive strain. And what does that lead to? Tendonitis or bursitis or inflammation of some body part because things are moving repetitively. If we think about throwing a ball over and over, a person may have a rotator cuff strain. Well, that actually is a repetitive strain injury. Carpal tunnel, as we talked about. How about a carpenter in their wrist or someone who moves their elbow lifting weights? If you just do things too much and too frequent, or the pounds and force of that weight is too great for the person's muscle strength, you can cause a strain, and therefore so-called a repetitive strain. So what do we do to treat it? Well, we try to first think of mechanics, try to avoid the problem. If we can take away the repetition, or wear a brace, for instance, in the carpal tunnel, or use a supportive brace for the elbow, we may actually mitigate or potentially reduce the chance of developing a repetitive strain injury in the first place. But what happens if you do develop it one? Well, if you develop a repetitive strain injury, it could take weeks or months to get over it. So we want to be a little bit more innovative. We want to be ways of thought of ergonomics and ways to control the aspect of it occurring in the first place, but then we need to treat the inflammation. Most commonly we'll use anti-inflammatory medicines, like an ibuprofen product. But if we think about taking away the inflammation, here at Maragal Medical, we may actually think about it in a greater sense. We may use laser therapy in a class 4 laser that can actually reduce inflammation and get to the root cause of the inflammation. We may use chiropractic adjustments in order to break down the repetitive bending and stooping and the strain that comes along with the ligaments, which could also occur at the lower back, pelvis, and hip region. If we think about physical therapy, we want to get your strength back, so we're going to put you on our exercise equipment. We're going to get your balance and strength back up to decrease some of that repetitive strain. And we think about new and innovative ways such as platelet-rich plasma or PRP, an excellent way to really help treat the inflammation that won't need to go 6 months or 3 months in time, because repetitive strain injuries occur when people do things over and over again, such as a worker. If you can't stop that activity because it's part of your job, you may be at risk for the repetitive strain that doesn't get better. So give us a call when you feel like you're in a poor ergonomic setup, you're having pain that's persistent, then we could perhaps break that down into the individual movements and look at the ways we can treat it and give you some standard but also more innovative ways to take care of it. We want you feeling better, we want you to keep moving, but we got to get you stronger and get you safe such that you don't have these injuries. They can be very long lasting and such a nuisance. Give us a call. We're here to help you. We'll put the team together. We'll see you next week.
That was great information, Dr. Marciello. I think you now all have a better understanding of the unique treatment approach that Maragal Medical has, utilizing that team approach where medicine, chiropractic, and physical therapy join forces to make sure each and every patient gets the best care possible. If you like the information you saw today, please consider subscribing to our YouTube channel. More information about our practice can always be found on our website at maragalmedical.com. Folks, our health is our most valuable asset, and you should be able to access that asset each and every day without limitation. Let the doctors at Maragal Medical guide you towards a path to wellness. Until next time, we'll see you then. Have a great day, everyone.